Yesterday, the Japanese government lifted the state of emergency measures for 9 out of the 10 prefectures, but a new set of restrictions are now being applied. Okinawa is still struggling with their COVID numbers and vaccinations, and we are only 30 days away from the start of the Olympics. This is the latest Japan COVID update on the coronavirus and vaccine situation here in Japan in our series, Japan Coronavirus 2021. There are not many major stories this week, but a lot of smaller issues that are making that news. So let's get started. Hi everyone, I'm Mike Matsuno, the man in Japan. It's late June and yesterday it was a hot 92 degrees Fahrenheit, 33 degrees centigrade. It's not too humid yet, but we're in for a hot summer from here on out. On this channel, I talk about daily life in Japan. If this is your first time to the channel and you're interested in hearing about Japan, please hit that like button and subscribe. Okinawa will be the only prefecture to remain on the state of emergency until July 11. 3 weeks ago, the weekly average number of new coronavirus cases per 100,000 people was at 120 in Okinawa, the highest number per 100,000 people ever recorded in Japan. But fortunately, yesterday it was down to 42 new cases per 100,000 people. However, anything above 25 is considered high and serious and at the highest stage 4 level. The biggest challenge for Okinawa is not only its high weekly average, but Okinawa is currently listed at 41st place out of 47 prefectures for the total number of people vaccinated. So Okinawa is now in double jeopardy with the highest number of new cases per 100,000 people, but also one of the prefectures with the lowest number of people vaccinated. From yesterday, Tokyo and Osaka will no longer be in the state of emergency, but will continue what is called the Quasi-rigorous anti-infection restrictions. Now I'm wondering, who thought of that name for this new prefectural restrictions? Quasi-rigorous anti-infection restrictions. Who even knows what that means? I mean, if someone in Japan asked you, excuse me, by the way, what COVID stage or level is your prefecture in? And you replied, well, we are in the quasi-rigorous anti-infection restriction period. I'm thinking, why did they give it a simpler name to understand? Even like in Hawaii, we have the official state fish called the humu humu nuku nuku apua'a. But we usually just call it the humu humu. But with this new official anti-infection name, you can't just shorten it to, yeah, we're in the quasi-rig, or, hey dude, quasi man. I don't think it works the same way with these serious health subjects. Anyway, if I were just roughly comparing the quasi-rigorous anti-infection restrictions to the former state of emergency measures, there really does not seem to be such a big difference, except regarding the serving of alcohol in bars and restaurants. In Tokyo especially, bars, izakayas, and restaurants have taken a huge economic hit these last 6 months because Tokyo has been in a state of emergency for most of the time since January, and for the past 2 months, along with Osaka, has not allowed the selling of alcohol in restaurants and bars. Since 40% of the revenue at most drinking establishments come from alcohol sales, many of these businesses have chosen to remain closed instead of staying open and not being able to serve alcohol. Think about it. How can a bar stay open if they are only selling non-alcoholic drinks like no alcohol beer and takeout food? Why would you go to a bar or izakaya to drink no alcohol beer or soft drinks or tea? But yesterday, Governor Yuriko Koike of Tokyo made the announcement that bars and drinking establishments will be allowed to serve alcohol, but only from 11 a.m. to 7 p.m. And they will have to close by 8 p.m. And only 1 to 2 customers can be served at one time. And there is a limit of 90 minutes maximum. So even with the end of the state of emergency measures, the quasi-rigorous anti-infection restrictions will still make sales very difficult in all bars and drinking establishments, because on the weekdays, most working people get off around 6 p.m. at the earliest. By the time you find a bar and sit down and order your first drink, it'll almost be close to 6:30. Then at 6:50, the waitress or waiter is already coming around for the last call on drinks, which they have to serve to you by 7 p.m. How much fun is that? I remember a couple of months ago being in this exact same situation in Kyoto when alcohol was only served until 7 p.m. I met my old college friend Hiro and his business colleagues at Kyoto Station at 6 p.m. We then walked to a nearby restaurant and sat down and first ordered a beer. By the time the beer was served to us, it was about 6:35. As we drank our first beer and talked, and then we ordered some food, before you knew it, the waitress came around at 6:50 to ask us for the last call on drinks. We were only about halfway done with our first draft beer, so of course, we were so surprised. So we just ordered one more drink before the cutoff time. I later learned that you could order more than one last drink at the last call if you wanted to, as long as they served it to you by 7 p.m. But you had to finish drinking everything by 7:50 p.m. because they had to have everybody out of the establishment and officially close by 8 p.m. So basically, the government does not want people to be drinking in bars, izakayas, and restaurants. And by imposing a very strict time and group restriction, they are basically trying to discourage people from going out to eat and drink. By this type of quasi-rigorous anti-infection restrictions, the government can still say they are being fair and allowing drinking-related businesses to stay open and operate. But the unread fine print is, but we will make it almost impossible for you to drink a lot, have fun, and spend a lot of time and money in your bars, izakayas, and restaurants. In short, the government wants you to go home and eat and drink. But if you have to eat out, then you can have a quick meal, grab a beer, and then leave and head home immediately thereafter. Last week, the chairman of the Medical Advisory Committee to the national government, Dr. Shigeru Omi, announced the committee's recommendation that there should be no spectators at the Olympics. Remember that the Medical Advisory Committee in Japan has no say or power in the setting of policy. It's very different from the CDC in the United States. They are strictly in an advisory role and can only advise and make suggestions. The Olympic Planning Committee and government will make the final decision on how many spectators will be actually allowed to watch the Olympics. Other than these two issues about the serving of alcohol and the number of spectators that will be allowed to watch the Olympics, there is not that much being reported in the news. Okinawa is still in a state of emergency, but you do not hear very much about what they are doing to combat the virus, new cases, or how they will increase the number of vaccinations of the Okinawan people. I had recently hoped that the U.S. military and the Okinawa government would join forces and use the U.S. bases and soldiers to help vaccinate the Okinawan residents. That would be a win-win, with the U.S. extending a friendly hand to help the people of Okinawa. There was an article about how the U.S. military base in Okinawa will vaccinate local resident employees who work on the base, but that is as far as it reached. I think the issue about the military bases in Okinawa is way too sensitive and controversial, and even if the U.S. extended to Okinawa an olive branch, it would not be accepted by the Okinawan government and people. And it's really too bad, because this definitely could be a win-win for both sides. Vaccinations continue steadily throughout Japan, but last week they had many unfilled reservation spots at the national vaccination centers in Tokyo and Osaka. Last week on the news, they were announcing that they will start accepting reservations for people 18 to 64 years old from this coming week. However, this is another one of those crazy snafus where what the left hand does, the right hand does not know, because you cannot make a vaccination reservation until you receive your official vaccine voucher or coupon, whichever word you want to use, which has a specific number assigned to you to verify your identity. Each city hall is in charge of sending out these vouchers to the residents of their home area. Outside of only 2 wards in Tokyo, no one else in Tokyo or any other major urban area has sent out these vouchers yet. Here in Kyoto, I know that no one under 65 years old has received these vouchers or coupons, and when I went up to City Hall here in Kyoto Nabe to ask them when they might be sending it out, they said they had no idea yet. So again, it seems meaningless to announce on the news that they have available spots open for vaccination in their national vaccination centers if no one can make a reservation because they have not received their vouchers or coupons. So this is just another annoying glitch to the inefficient vaccination system rollout here in Japan. Another complaint I hear is that people are saying that the vouchers are needed so people can verify their identity. But people say, why can't we use our Japanese driver's license or my number card, which is like a social security card, or foreigners could use their alien registration? It is a good question, but I'm sure it's all about the rules that most people do not even know why they exist. Also, maybe they are worried about being overrun with people coming in for vaccinations if they don't strictly control the system. I don't know, but it seems very sad that Japan has enough stock of vaccines for most of the nation, but the government has so many layers, outdated rules, and hoops to jump. So many people who really need the vaccines don't get them in a timely manner, and that causes other problems for them. Some larger universities in Tokyo and Osaka are setting up their own vaccination systems on their campuses for their staff and students. A friend who teaches at Kinki University in Higashi, Osaka, said that Kinki will start this week, and he has a reservation to be vaccinated today. So some places in the private sector are moving faster than the government. Businesses are also being encouraged by the government to set up their own vaccination systems within their company facilities. You see many larger businesses like Toyota setting up vaccination centers within their property and facilities. But this is very difficult for most small and medium-sized companies, as there's a cost-effective point that they cannot set up such a system without a larger scale, as well as they would have to find and hire their own doctors and qualified nurses to give the vaccination shots. At the posting of this video, Japan has vaccinated 20 million people with 1 shot and 8 million people with 2 shots out of the total population of 126 million Japanese. The government's push to complete the 65-year-old and older group, made up of 36 million by the end of July, is steadily increasing to 45% with 1 shot and 13% with 2 shots. Prime Minister Suga continues to proudly repeat on the news that Japan has vaccinated so many millions of Japanese and is ahead of the government's estimated vaccination schedule. But what Prime Minister Suga conveniently forgets to mention is that Japan was and still is so far behind other advanced nations. So using the example of running a marathon, whether you finish the marathon race in 10 hours instead of 15 hours will not really matter when everybody else has finished the marathon in 4 hours. So he's just trying to spin the situation of the white elephant in the room, where the Japanese government completely dropped the ball on the rollout and implementation of speedy vaccinations in Japan. Thank you for watching this video. And if you like the video, please hit that like button and subscribe. Until the next video, catch you on the backside.